of those vaccines, how many placebo-controlled studies have been done on vaccines on the childhood schedule?
Senator, that'd be a very difficult question to answer, and the TGA might be able to add to that,
Sure.
Who do the initial assessment on the safety and efficacy of the vaccines.
Sure.
Thanks very much. I'm just going to ask Dr. Nittenbergul, who's one of our senior medical officers, to the table to respond, Senator.
Thank you, Senator, for the question. Dr. Nitin Bagul, Principal Medical Advisor, Prescription Medicine Authorization Branch, Medicines Regulation Division. Can I please ask you to repeat the question? On
yeah, the question is, how many placebo-controlled studies have been done on vaccines on the childhood schedule?
I can take that question on notice. I don't have it in hand at the moment.
You need to take that on notice?
Yes.
I would just highlight, if I may, Senator, this is a question that's also been asked of other regulators. I think part of the challenge that we have is that while it is frequently held that placebo-controlled or double-blinded or randomised controlled trials are the gold standard in science, and certainly in the introduction of new medicines, particularly when there's no established standard of treatment, that is often the case. There are fairly substantial ethical questions to be answered around introducing a placebo-controlled trial when there is a demonstrated effective medication that is used to either prevent or treat treatment. So, for instance, given that we do have demonstrable efficacy of vaccines for many vaccine-preventable diseases, it would be ethically not only questionable but probably not arguable that a placebo-controlled trial would be appropriate, given that you would actually have to specifically not vaccinate children, expose them to the disease that we know has serious morbidity when we also know we have an effective prevention.
These are injections that we're giving to almost every child in the country at the moment, and they're not, and we can't say at this stage. You have to take on notice how many placebo-controlled studies have been done, which is the gold standard.
No,
it's not the gold standard.
I might just try and explain it in a different way, Senator. The gold standard for science is contextual, and so when there are new treatments to be determined, absolutely there is a preference for a placebo-controlled trial. So you can compare a control arm with an intervention arm, and that way you're able to remove a number of the confounding factors, but also able to demonstrate both the risk and the benefit of that treatment. When there is an established treatment for which there is not only demonstrated efficacy in terms of preventing the disease and the consequences of the disease, but also decades of real-world evidence on the safety and the positive risk-benefit analysis, the lack of an ethical basis for a placebo-controlled trial where, as I say, there is an accepted and efficacious treatment for a significant disease with significant morbidity, that cannot be described as gold standard.
How many are we talking about? Many of these cover multiple antigens, and I think in 1990 the full schedule was 21 antigens, and now it's about 60. So with that in mind, what placebo-controlled safety studies have been done examining the combination of multiple antigens in these injections?
Yes, so thank you for that question as well, Senator. The growth or the evolution in the immunisation schedule, and again it might be something that Dr. Pete might like to comment on, has been cited as a challenge, and it has been in some quarters, and I'm not suggesting you're doing this at all, Senator, but in some quarters has been spuriously associated with the rise in certain diseases or disease states. The reality is the antigenic load that is experienced by children has decreased over the years, despite the fact that the number of antigens which provide coverage.
How is that?
The volume of the antigenic load.
So, all right. So with that in mind then, back to the question, what placebo-controlled safety studies have been done examining that reduced antigen load?
Yeah, so I think it's so the comment about the antigenic load is not around the impact or the immunogenic response in the patient. It's about what is presented to the children. And there is an enormous amount of work that's being undertaken by ATAGI on a regular basis in recommending the what goes into the schedule, and that's one of the considerations. I think, as Dr. Buggle has said, we will provide you with information. Okay. Given the number of vaccines and the number of diseases for which we vaccinate, it would be more appropriate, I think, probably to
I'm staggered that can't be provided now, given the history. But just to go back to your point,
information on notice.
Yes, all right.